These are the 4 weight loss operations that I offer in my practice. The sleeve gastrectomy and the mini gastric bypass are the most commonly performed operations in Australia. All of the weight loss operations work predominantly through producing a sustained decrease in appetite, allowing people to eat less food and thus lose weight. This video will describe the sleeve gastrectomy. Here we can see the stomach being lifted up and some of the fat from the outer edge of the stomach is removed as shown in the bottom left diagram. As we move closer towards the top where the diaphragm sits, we'll see a shiny dark organ, that's the spleen. As we get to the top part of the stomach, we can check to make sure that there's no weakness in the diaphragm, allowing some of the stomach to slip up into the chest. If this is discovered, it's called a hiatus hernia and needs to be repaired before we can proceed with the rest of the operation. If we didn't repair that, then reflux would be a particularly bad problem for that individual. A hiatus hernia diagram is shown in the top right hand side of the picture. Once we've removed all of the fat from the outer edge of the stomach, we can introduce our staplers that both seal and divide the stomach, firing 3 rows of staples either side of a knife. So here's the first stapler. Our anaesthetist will then pass a tube down through the mouth that sits in the stomach and helps to guide me in terms of how wide I'm making the stomach that we're going to leave behind, that will become the new conduit and storage sac for food. Once we've removed the stomach, I take the fat that we've removed and I sew it back onto the stomach staple line in a few strategic places to help to stop the stomach from twisting, and because fat's very good for helping healing. Once all of that's complete, we put the stomach piece that we're removing in a plastic bag and we bring that out through one of the 5 very small incisions in the abdomen. The whole operation takes typically around about 1 hour to perform. It's the most commonly performed weight loss surgery in Australia. It's pretty simple in concept and has the lowest risk of the surgeries I perform, and yet it still leads to good weight loss for the majority of people. The way that it works to help lose weight is predominantly through a reduction in appetite, and that happens because we've all got a muscle that's normally closed at the bottom part of our stomach, and when this is closed it leads to a rise in pressure. That pressure is detected by some nerve endings called stretch receptors that send signals back to the brain to turn off our hunger and our appetite. The other way it attacks appetite is that there's a hunger hormone called ghrelin that's produced in the stomach, and by removing part of the stomach we reduce the amount of ghrelin that your body has to work against you to make you feel hungry. The second way it helps lose weight is by minimizing the amount of food that you can eat in any one meal. Typically, people after a sleeve gastrectomy are only able to eat something like a styrofoam coffee cup full of food. Reflux can become an issue because acid, which is made in the lower part of the stomach by the nature of the design of the sleeve, is pushed upwards near that blue arrow. If it gets up and beyond the diaphragm and into the esophagus, that's when it can create heartburn and an acid burn in the bottom part of the esophagus. This occurs in about 1/3 of people who have a sleeve gastrectomy, unfortunately, and those people will need to take long-term antacids. Sometimes the reflux is very severe and more surgery needs to be performed, and that's typically a conversion to a bypass operation. Luckily, that's quite rare. About 1 in 50 people with a sleeve gastrectomy will end up with that problem. A surgical complication called a leak can occur with this operation, and we see that in around about 1 in 100 cases. People who develop a leak would need to come back into hospital to treat an infection and stay for usually just a few nights, and we can usually rapidly bring that under control for them. But nonetheless, it can be a scary and occasionally difficult to treat problem. It's an irreversible operation because obviously we can't put the stomach that we've removed back, and people do need to take multivitamins, particularly while they're losing weight with this operation, but perhaps less strictly than they need to with the bypass operations. In order to perform the surgery, we need to shrink the fat from the liver so that we can push the liver out of the way, and we do that with a low-calorie diet, which is taken for 2 weeks before surgery. Well before that, people meet their nutritionist who will give them advice about how to cope with that 2-week period. The backbone of that is usually OptiFast. After 1 to 2 nights in hospital, people are discharged on a liquid diet and slowly progress to chewable food after around 6 weeks. The reason for this is that after we've created the tube-like stomach, things will feel quite tight, meaning only liquids can go down, and if people advance too quickly to solid food, that food can become stuck and be very uncomfortable and occasionally require endoscopy to deal with it. A sleeve gastrectomy is probably the best option for anybody who is young, not diabetic and not too heavy, and particularly if they don't have any bad reflux, and is really the only option if somebody is a continuing smoker.
Well, I hope you found that helpful. You can access lots of information on my website, but we'd love to hear from you. You can get in touch on my email or during business hours on the phone number.